Good afternoon. Welcome to the afternoon briefing at St. Clair County Emergency Management Agency. Joined here today with the Assistant DMA Director Brian Whitaker, who will be giving us the up-to-date numbers, which are not really the best.
No, not today. Definitely an increase from yesterday. So for today, tested, we have 43,163 tested, which is an increase of 593 from yesterday. Of that, we have 4,344 positive tests, which is an increase of 62 from yesterday. Those are males and females under 10 to their 70s. That brings our daily county positivity rate today to 10.5%. For negative test, we have 38,824. And for deaths, unfortunately, we do have to add one additional death today, bringing our total to 158. That was a male in his 60s who did have underlying health conditions, and our thoughts and prayers go out to his family. For those that have completed the IDPH required 14-day quarantine, we are at 3,275. For state totals today, we've crossed the 3 million mark. We're now at 3,032,634 tested, with 192,698 positives. That is an increase today of 2,190. For state deaths, we do also have an additional 18 deaths, bringing that total to 7,631. For hospitalization numbers, and that is for those hospitalized in St. Clair County hospitals, our number today has increased to 50 patients with COVID-related illness, and 2 of those patients are on ventilators. For our congregate living facilities in outbreak status, and that is a facility with 2 or more staff or residents with COVID-19 or COVID-like symptoms, today we only have one change, and that is one additional case at Caseyville Nursing and Rehab, bringing them to 16 cases. Director?
Yes, thanks, Brian. We were waiting for Chairman Kern to be here. He was at another engagement meeting today, and he hasn't made it back, so I will do the honors of updating the zip code, and if he happens to come in, we'll let him pick up, and he can close out. Today, the zip code's 62059, stays the same with 10. 62201 goes up by 1 to 190. 62203 goes up 3 to 159. 62204 goes up 1 to 120. 62205 stays the same at 161. 62206 goes up 3 to 357. 62207 goes up 4 to 208. 62208 goes up 3 to 278. 62220 goes up 6 to 357. 62221 goes up 5 to 384. 62223 goes up 6 to 208. 62225 stays the same at 17. 62226 goes up 5 to 445. 62232 goes up 3 to 93. 62239 stays the same at 53. 62240 stays the same at 17. 62243 goes up 1 to 33. 62254 goes up 1 to 131. 62255 stays the same at 13. And 62257 stays the same at 23. 62258 goes up 2 to 75. 62260 goes up 2 to 66. 62264 stays the same at 70. 62269 goes up to 5 to 310. 62285 goes up 1 to 40. And those are the zip code numbers for today. Brian, I wanted to take some time. There's a lot of questions that come in, and a lot of our good St. Clair followers, St. Clair team members, talk a lot about the positivity rate. So let's explain to them the numbers that we're watching daily, the difference between that daily positivity rate, because as we said today, it went up significantly. and then our 3-day running positivity rate.
Absolutely. We look at various different ranges. So our daily positivity rate, as you said today, 10.5%, a drastic increase from yesterday. However, not something that is overly alarming depending on testing. As we saw today, only 593 tests. It's the first time in about the last 5 days we've had under 1,000 tests. So with lower number of tests, we sometimes see that number higher, and that's why the 3-day range and the 7-day range is so important. Our state positivity rate today for the region is 7.1%, and that's calculated on that 7-day rolling average. So they take the average of the last 7 days to come up with that day's positivity rate, and so on and so forth, because we only have one testing site here in St. Clair County that does the rapid testing where you get the results on the same day. Everywhere else, it could be 2, 3, 4, 5, some as long as a week before you get those test results. So you have to have that rolling average in order to truly see where your positivity is at.
Well, and that 3-day rate, as you said, is up to 7.1 today, up from the 6.8 yesterday. So it's creeping back up there. The answer to that is more testing. But the way to fix that is if we could get those tests back quicker, which we have no control over.
Correct.
That. We talked about that yesterday. Some people, blaming the health departments, the St. Clair County and Eastside Health District. And as I said yesterday, we can't blame them. Those men and women are doing their best to do everything they can. And it's not really, it's just the labs are backed up. And
Correct.
That's who they're waiting for.
And St. Clair County has been working since the beginning of this to try and get testing equipment here in our county. And that today just doesn't exist. We're using private labs in our county, and also a lot of stuff is going to IDPH labs. And then there was the state lab that was sent down and is based in Anderson Hospital, where we had sent some tests. But since the backlog up there, we haven't been able to send tests to that lab.
Well, and that's the thing we heard Chairman Kern say yesterday. The state representatives are trying to get another or 2 pieces of equipment to house here in St. Clair County to help speed that process up. But again, we can only keep asking, and that's what we're doing. We're trying to push all the right buttons that we can to get that done. Now, next week there are 7 days of testing going on in Madison County.
Correct.
And we've got those listed on our site. So we encourage anybody who's wanting to get tested to go get tested. You're just going to have to drive over there, and then hopefully the following week we'll have a few of the days back here in St. Clair County of those state testing sites.
Yeah, Barb Holt talked about that yesterday. Probably the end of that following week, she was trying for Wednesday, Thursday, Friday to get sites here. And testing is important. Testing is an important process of this to determine where the virus is. Everyone asks, well, why should I get tested if I don't feel sick? And we've heard the professionals that came in here and said, because there's a large amount of asymptomatic people that have carried that virus.
Exactly, and you look at the other numbers that we keep an eye on. Our hospitalizations jumped up overnight from 41 to 50, and we've said that all along. I had one of the physicians text me a week or so back, and late at night, and just said that they're seeing more patients coming to the ER. Which is really alarming to them because, as we see, we go from 41 to 50. We did drop down one on a vent, but we also added an extra death. That's kind of the other numbers that we watch, because nobody wants to add any numbers into that death column.
Well, and there was a lot of talk that this was only something affecting the elderly or the immunocompromised, those in nursing homes. We haven't seen very dramatic increases in our nursing homes like we were seeing earlier on in this virus. Today, only one of the 62 cases comes from a long-term care facility in St. Clair County. The other 61 of those cases are community spread. And as we look at those age ranges, 41 of the 62 today under the age of 40. So it is definitely in those lower age groups.
Exactly, and that's why we continue to push the social distancing, the wearing of the face covering, and we're going to continue to do that until this thing gets under control. We have to. The last thing is, we keep saying we don't want to go backwards. We get a 3-day run of that positivity rate over 8%. That's when you think people are complaining now? If we go backwards, the phones will be ringing off the hook.
And nobody wants to go backwards. Nobody is sitting here saying, hey, can we get there so we can close businesses down? That's not the case. They're asking for compliance. Hey, help enforce this. Help make your residents, help make your customers wear their masks while they're in there so we don't have that spread. So those numbers do go down and it doesn't negatively impact there. We saw a lot of changes after the announcement yesterday from the health departments as it relates to schools. The last thing any of those superintendents wanted to do was make a decision to go to remote learning. They want the children back in the classroom. But they also want to make sure that if they're in the classroom, they can keep them properly spaced. They can keep them wearing a mask. They can help prevent those children from carrying that virus home to parents, grandparents, others that might be more vulnerable.
Well, and we saw on the some of the comments that was made yesterday and some of the information that came out. And I think Susan said it yesterday. Susan Sarfati is director of the regional superintendent of schools. Basically said it's a balancing act. You got a group of people that want it this way. You got a group of people wanting it that way, and I guess that's just life. But as I've said, the teachers, the administrators, the superintendents, they're all doing what they can. They had to throw this together real quick last year or earlier this year, and now they're finding themselves in the same situation. They're not going to do anything to put those children in harm's way or their staff members. We got to understand some of those teachers are human. I mean, all of them are. They have health issues themselves. So the administrators and superintendents have to look at the whole picture, and they all have to take into consideration the parents' work schedules and things like that. That's why they sent out those surveys. Mm-hmm. And I think from everything that we saw, they tried to be as fair as they could. There is no one-stop shop here.
And I think something important to mention, we've had a lot of questions about it onto our page and a lot of comments, and we're not to pass the buck, but referring a lot of these questions to their school district. People are saying, what about my child that has special needs and needs special consideration? The important thing here is communication. Talk to your school district. There are many of these districts that are still allowing small groups of kids that need that individualized education to be at the facility because they can properly social distance, they can properly disinfect and give them a safe environment because maybe they wouldn't be able to adapt to that remote learning. But the important thing is communicate. You got to communicate with your school district and see what services are available.
Well, and every superintendent or administrator that we've had on over the last week and a half has expressed that. Mm-hmm. Communications, call your district, ask those questions, don't wait until the last minute. And even though time is upon us, because some of the schools are starting as early as next week. Mm-hmm. So in all fairness to our health departments, again, we were waiting for some guidance from IDPH and the state school board. We still haven't got that as far as I know. We was waiting for it yesterday, but the Eastside Health District and St. Clair County Health District put out a strong recommendation, and that's what it was, recommendations, and the districts, I think, did the right things. The ones that we were getting notified from last night, that they were changing their plan, and that was one of the things that we asked the administrators and the superintendents, what if? And they all said, we're watching your numbers, we watch your briefings every day. If we have to adjust, our plan will allow us to do that.
And the majority of the modifications we saw last night were 4-week modifications through September 11th. They will make a decision further after September 11th. So it's not like they're saying, hey, first semester, you're out of school. No, they're needing more time to see what this virus does, what the spread does, and how they can continue to adapt their school environment to the amount of students that are wanting that in-person learning. We see a lot of the districts that even once in-person learning is available are still going to have that remote option, and an overwhelming amount of families here in the county are choosing that remote option.
Well, and again, we said it yesterday, this thing is changing by the minute, by the hour, by the day. And Team St. Clair members who are supporting it, wearing your face covering, sharing this briefings, getting it out to your families and friends. As I said yesterday, I've seen more of our county residents wearing masks in stores. We've heard more reports. Last night, I bet I saw a dozen different comments that individuals were in this store or that store and the cashier had the mask on, or they went through a drive-through and they had their mask on. Those are the type of things that we know the word's getting out there. And yes, I'll say it again, there are those doubting Thomases out there, those naysayers. Forget about them. They have their opinion, and I respect their opinion, but we're not going to change them. So don't get stressed out over that. Let them have their 2 minutes of fame if that's what they want to do. Come on here and say that you're sheeps, you should be wearing masks. Don't let that distract you, because we're basing all of our information on scientific evidence. As we said, we have had medical experts from right here in our county that have sit at this briefing and said wearing masks is the best precaution that you have, especially if both people are wearing them, if you can't maintain that 6-foot distance. These are the same medical experts that if you get sick or you break an arm or you have a heart condition, that you're going to go to the hospital and you're going to let them treat you, but you don't want to take their advice on this. It's just mind-boggling.
Absolutely. And many have understood the message. Many have changed their minds with, maybe they didn't believe at first, and then someone in their family or friend came down with this virus, and now they understand that they need to react a little differently. And it's a small ask for keeping our businesses open, keeping our economy going, and moving through this virus.
Well, and what we talked about yesterday, we don't want to see any business shut down, even though there has been a couple of them here in the county that didn't adhere to the recommendations. As Barb Holt said yesterday, they have sent out letters to businesses that they have inspection rights over, and all they're asking, and you said the operative word, compliant. We want you to stay open. You as a business owner should want to stay open. But as I said, if you get closed down or if we go backwards, it's nobody's fault but our own. We all have to be responsible for this. Not one person can do this. Everybody wants to blame the governor. They want to blame the president. They want to blame the Democrats. And this isn't about politics. Until somebody shows me that this virus knows our political agenda, I don't even want to hear about that. This is about fellow man. This is about us taking care of our friends, our neighbors, and being respectful to them. And I think that's just the way it's got to be if we want to get this behind it. So, yes, we get complaints here every day about this store or that store. And as I said to a few of those comments last night, pick up the phone and call that business and say, hey, I was in there shopping. I didn't feel like it was safe. The cashier or the people who were taking care of me didn't have a mask on. A lot of time, if management doesn't know what's going on, they can't fix the problem. So that's the first place to start at. Nobody wants to have the mask police out there. And if you wear it, I'm telling you, and I've said it before, if you add up the amount of time that you have to wear that mask in a 24-hour period, you'll be surprised the least amount of time you have to have it on.
Correct.
So we got Cindy going to be here to translate this over into the Spanish community. And then we will be back tomorrow afternoon with our question and answer Sunday afternoon. So if you have any of them, the information will be up later. You can put your comments on there and we will try to get them answered. If not, you can tune in tomorrow and we'll try to answer as many of them as possible. So have a good rest of the evening. Remember, wear your mask, wash your hands, and watch your social distancing. And as I say all the time, if you do that, you will be a part of the solution, not a part of the problem. See you tomorrow.